Asthma is a disease that affects many people each year. Asthma is a disease that affects the airways of the lungs. Asthma has two main parts: narrowing of the airways caused by muscles tightening around them and swelling of the airways. Because of this narrowing and swelling, it makes it hard to breathe. Many people believe that asthma is something that a person gets and then the asthma goes away. This is a myth. It is not true. When you have asthma, you have it all the time. It is important to watch for signs of asthma symptoms. You don't have to let asthma slow you down. You can have an active life when you learn to control your asthma symptoms. Asthma symptoms can include coughing, wheezing, shortness of breath, or chest tightness. You need to know how to prevent symptoms from getting started. It is much better to be able to identify symptoms early so you can prevent problems. If you wait too long, the asthma symptoms may become very serious. What might have been a minor problem can become an emergency if you wait too long. The rule of twos is a way to determine if your asthma symptoms may be out of control. Ask yourself these questions. Do you have chest symptoms more than twice a week? Do you wake up at night with shortness of breath more than twice a month? Do you have to use your rescue inhaler more than twice a week? Do you need to fill more than 2 rescue inhaler prescriptions in a year? If you answer yes to any of these questions, your asthma may be out of control. Avoid triggers. They are things that allow asthma to start or flare up. There are many known triggers for asthma. You should try to remove as many triggers as possible in your home and workplace. However, you need to understand that it may not be possible to completely remove all asthma triggers. Some of the most common triggers are things that people are exposed to every day. These things may be dust in your home or cigarette smoke. Other triggers that many people are aware of are ragweed, pet dander, and cockroaches. Here are some triggers that many people may not be aware of. Weather conditions, such as high humidity, high temperatures, or very cold temperatures. Infections such as the common cold and the flu can also trigger asthma symptoms. Exercise can also be a trigger for asthma. There are a number of diseases that seem to mimic or feel like asthma, but are not asthma. One of these is vocal cord dysfunction. Vocal cord dysfunction involves the vocal cords closing when they should be open. This blocks the air as it comes into the throat. When this happens, you can have shortness of breath, and you might also make a wheezing sound. Another disease that mimics or feels like asthma is chronic obstructive pulmonary disease, COPD, or emphysema. This is usually seen with older people and people who have a history of smoking. Congestive heart failure, or CHF, is also a disease that can look like asthma, but is found usually in older people. Shortness of breath is a common symptom in both diseases. GERD is another disease that looks like asthma. It is also called GE reflux disease. Many people call it heartburn or ulcers. People who have asthma have a 50% chance of having GERD or GE reflux. Learning about asthma during its early stages is very important in the treatment of asthma. Most people with asthma take medications. There are 2 types of medications for asthma: control and rescue. Most people use at least one of each. Rescue medications work quickly to open up your airways. Take your rescue medications to help stop a flare-up once it's begun. It is used when the symptoms come on suddenly with an asthma attack. It is important for everybody who has asthma to have access to their rescue medication. If you need to use a rescue inhaler more than twice a week, you may need additional help. Remember the rule of twos. This may be a sign that your asthma is not well controlled. Control medications are the other type of asthma medication. They help to reduce the chances of having a flare-up and help to keep your asthma under control. People with asthma should take their control medications each day, even when they feel fine, to prevent asthma attacks. Nebulizers are another way to use asthma medications. This is done with a breathing machine. Testing your lung function is an important part of your asthma care. Testing can be done at home by using a peak flow meter or a more detailed test called spirometry, which is done at your doctor's office. A peak flow meter measures how well you are breathing. You can use it to find out if your airways are getting tighter. It works even before you have signs of a flare-up, like coughing or wheezing. This is an easy device to use. A peak flow meter score of 80% of your personal best or better usually means your asthma is well managed and under control. A score between 50% and 80% of your personal best means you need to carefully watch how well you are breathing and take your asthma medications as directed by your doctor. And a score below 50% of your personal best means you should consult your healthcare provider now. It's important. An asthma action plan will help you prevent flare-ups and can be helpful especially if an asthma attack occurs. Your plan can help you decide what medications to take, when to take them, how much to take, when to get help. Update the plan every 3 to 6 months with your healthcare provider. Learn how to recognize asthma triggers and stay away from triggers that can make your asthma worse. Make an asthma action plan with your healthcare provider. Use a peak flow meter to check your asthma regularly. Take your asthma control medicines as instructed by your healthcare provider. Get a flu shot every fall or early winter. And get a yearly physical or checkup. Asthma affects many people. The more you know about asthma, the more it may help you or a member of your family. For more information about asthma symptoms, or about other topics in this series, please contact your healthcare provider.